For the time being, Africa seemed to be less affected so far. Thanks God. Total number of reported infections are about 37,000, which is not very high. Almost 20,000 of these infections are in 4 countries: Egypt, Morocco, Algeria, and South Africa. These are the 4 most developed economies in Africa, and they, much better connected to Europe and the rest of the world. So it's understandable. But there are a number of possible reasons for the low rate of infection until now. One reason probably is the demographic profile of Africa. We have less old people, we have more young people in Africa. Half the continent is below 19 years old, so that may help. There is definitely underreporting. We don't have the statistical capacity really to track and register. And also, many Africans will not go to a doctor if they cough or they go to a hospital, and maybe there's no hospital nearby anyway. So, but given all these factors, we are really puzzled so far, and we looking for the future with anticipation and hope. Let us hope that this pattern continues. But what worries me really, probably even more than the virus itself, is the severe economic impact on Africa. That's what really worries me. We expect Africa to go into a recession for the first time in 25 years. Our raw materials are sitting there. We're unable to export it. Factories are closed down around the world. Shipping is almost non-existent. All the industries around raw materials are shut down. SMEs are in deep trouble. So we're really facing a serious economic challenge, and that's what really worries me. It is very interesting to watch really African leaders acting, and I must recognize the African Union for the leadership. From early on, it acquired ownership of this and shows leadership, which is good. President Ramaphosa, as a current head of the African Union, did engage and try to mobilize the African leaders and engage with the international community, which is really good. We see for appointment of 4 special envoys, our friends Ngozi and Kapruka, Trevor Manuel, and Tijani Siam, very credible people to really engage with the world at large, trying to see how can we help, especially the private sector. So Africa really reacted well. Most of the African leaders took decisive actions early on, which is good. But what we really need is some more emphasis on the economic crisis that's going to face us. And Africa has over $374 billion of debt. This year alone, we need to pay about $44 billion of debt interest alone, 44 billion. At the time when the economy has been severely hit, the economy is in limbo, actually. And we expect that Africa will slide into recession for the first time in 25 years. We need some action there, and we hope to see some leadership at a global level as well. What helped in Africa as well is that we have developed some experiences with dealing with health crisis, whether it's Ebola or other pandemics. The creation of the CDC, the Africa CDC, the African Center for Control of Diseases and Prevention. That was a major step forward, really. And that helped. It created some laboratories around. I heard that a laboratory in Senegal, which was established to deal with Ebola, managed to develop a test kit for COVID-19 at a cost of $1. That's wonderful. How people are able to respond. So we had some experience in Africa in dealing with pandemics, and that may help us also as well. But the crisis also point out clearly the need to support and develop our health structure and health systems. We spend very little in developing our health delivery, and that needs to change. Actually, it needs to change all over the world, not only in Africa. It's clearly health is one of our priorities, and we need to spend more. We need to have better governance. This is what we all time talking about, have to have a better governance in order really to deliver the basic services for our people. So that's something really we need to pay attention to. It's not enough when we are in trouble to go out and overload our health workers. We need really to offer them better support than that. It's very helpful that our African leaders really imposed a lot of restrictions early on. We can see lockdown has been implemented in most African countries. But the problem, these lockdowns cannot really continue for a long period because we are not capable to sustain this. Many of our people earn their livings daily, day by day. If you don't work today, you don't have dinner. They have to go out to do something. Have to go to the market, they have to sell the labor here or sell the labor there. And if they don't go out, they die of hunger. In advanced economies, lockup was assisted really by general fiscal, financial offers by the government to people. I mean, in Britain, government said, fine, I pay your salaries. In Germany, I pay 67% of your salary, just stay home. So there's a huge financial incentives offered by the government, large subsidies, and that help people staying at home. But in Africa, who's going to provide that? We don't have the fiscal space to offer this giveaway to our people. Advanced economies is spending something like $5 trillion in all kinds of incentives to individuals, people, and to companies, businesses, $5 trillion. And in Africa, there's nothing really. So that's the challenge also for us. We cannot look up people without feeding them. And we are unable to feed them because we don't have money to feed them. So that's a problem for us. Africa international partners, what to say? We heard some very positive really positions by European leaders, some 8 or 9 European leaders, France, Germany, Spain, Portugal, Netherlands, etc., co-signed the call for action introduced by Ramaphosa and other African leaders, about 9 of them, which was a wonderful statement. And it called really for sharing the knowledge, sharing the protective equipments and the test gear, etc. And of course, called also for a decent incentive, financial incentives package of about $100 billion. That was good. That was a call for action, but I have not seen the action. So I don't know. There seemed to be some goodwill, but how that goodwill will be translated into action, we don't know. The IMF apparently is offering probably $50 billion for the least developed countries. That's a step in the right direction. But what about the countries in the MDC, in the medium developed countries, which is a little bit above the LDCs? They're going to need help. Where is it going to come from? What about countries like Sudan, my own country, or Zimbabwe, who suffer from sanctions and so as such may not be eligible for international assistance? I think we need to deal with that. Unfortunately, during this crisis, countries are very much preoccupied by dealing with the crisis themselves. So everybody looking internally, and we're not really looking outside our borders, maybe only to stop people coming in. But moving forward, I think we'll have to appreciate that this is a global disaster. It's a global pandemic, and it needs a global response to it. And as the call for action letter signed by European and African leaders stated, that victory will only be declared if we defeat it in Africa. So that is an important statement. We need to sort out really this economic dilemma for Africa, and we need our friends to stand with us. Very obviously, a main component of any financial aid will be dealing with the interest payment. G20 already decided to defer interest payment until the end of the year, but that's not enough. We need about 2 years of deferment of payments, but that's a public debt. We need also to find a way to deal with the private debt. I heard that our brother Tijani Siam trying to develop a project there where private debt probably can be put in what I call like a bad bank and dealt with separately. These are all ideas. We hope to see some of them really fulfilled. This problem in this pandemic is not the only problem we are facing at the moment in Africa. We had the problem with the locusts. The locusts devastated the farmlands in East Africa. So a lot of people there are faced with hunger again. It is a problem. It's happening, having to be synchronized with the epidemic. So it is a problem we have there, and we hope to see concerted action. But also, we need to see a proper governance of whatever aid or committees made, how to be governed, how to be dealt with. That is important. I hope to see also better governance for global institutions. At the moment, unfortunately, what we see is a fracture in the global order, and we see the battle of words between the United States and China, which is not helpful at all when they have the top two economies around the world locked up in this ridiculous spat, which is not helping anybody, and also is complicating the work of all the international organizations. Is not helpful. I hope to see some improvement in the way our international multilateral organizations are run and governed. That's really important.